Dr. Charles Cairns. He's Dean of Drexel University's College of Medicine. Doctor, thanks for being with us.
Pleasure and honor to be here, Tracy. Thank you for having me.
So we see the side effects of other vaccines, particularly the flu, very similar, it sounds like. Are these potential side effects something to be concerned about, or is this pretty normal?
I think they're pretty normal. And, the good news is that most side effects from vaccines happen pretty early. So I think that we don't have to be quite as concerned about the fact that these trials have taken place so quickly. And I think the appropriate safeguards have been in place to address safety.
So do you think that they will be enough to deter people, because there has to be a second dose too? Would it be enough to, you get the first dose and somebody says, okay, I'm not doing that again, I'm not taking the second dose?
Well, I just think we have to look at the opportunity that the vaccine provides. And, there's always a trade-off, right? Medicines typically aren't effective unless they have some effects. In this case, the preliminary data we get from the Pfizer vaccine trial is that this vaccination program is extremely effective, 90% effective. And so having expected side effects, I think, should be par for the course. I do think that it's important that there are two different doses. And so we're going to have to be diligent to make sure people get both doses in order to optimize, if not maximize, the protection afforded by the vaccine.
We've seen how misinformation can lead some people to be skeptical. There are many, depending on what research you look at, who are saying, nope, I am not doing it. Which, again, we have a solution, but it's people's behavior that will keep us from solving this issue. What's the answer?
Well, we clearly need to address it. In fact, I've been seeing some polls where as few as 35% of the people said they would take the vaccine, and that 60% said no and 5% weren't sure. So clearly there's a big gap in terms of people's willingness to take the vaccine once it becomes available. So to address that gap, I really think we have to address health literacy, so people understand the benefits of vaccine and, frankly, the consequences of getting this infection. I think there also needs to be plenty of access tools so that people, when they hear about the vaccine, know there's a plan to get it to people in a timely manner. Because the challenge that we face is that we're in the midst of this pandemic with cases escalating record-setting days in terms of the number of cases. And unfortunately, 250,000 people have already died in the country. So it's an important problem. We may have an effective vaccine. Once it's proven to be so, let's get it out to people so that we can get the best benefit, not only for them individually, but of course for the populations that are so vulnerable to infection.
Thank you, doctor. We appreciate you.
Thank you.